We often think of the human body as this resilient machine, but imagine an invasion so severe it not only causes our own tissues to die, but also produces gas within those tissues. It sounds like something from, well, a terrifying story.
It really does. But it's the grim reality of gas gangrene, a really serious infection where the body is locked in a desperate battle.
A truly intense fight, and apparently medicine has this surprising, almost counterintuitive tool: high-pressure oxygen.
That's right, hyperbaric oxygen therapy, or HBO. That might sound odd, using loads of oxygen to fight an infection, but there's solid science behind it.
Exactly. So for this deep dive, we're going to explore how this high-pressure oxygen therapy is used to tackle gas gangrene. The medical term is Clostridial Myonecrosis, right?
Correct. Clostridial myonecrosis. We'll get into the why it works based on handbooks on hyperbaric medicine and, related research.
Yeah, we'll keep it pretty accessible, aiming for anyone with a basic science background. Okay, let's unpack this. What exactly is gas gangrene? What are we dealing with here?
Okay, so gas gangrene is a severe and often very fast-moving infection. It's caused by bacteria called Clostridium.
Clostridium, okay.
Yeah, and one specific type you hear about a lot is Clostridium perfringens. It's a common culprit.
All right. And what makes these bacteria so dangerous in this context?
Well, a key thing about them is they're anaerobic.
Anaerobic. Meaning they don't need oxygen.
Exactly. In fact, they thrive where there's very little oxygen or none at all. Think of it like deep wounds or tissues with poor blood supply. That's their ideal home.
Huh. So the very thing we need to live, oxygen, is actually bad news for them. That feels backwards.
It does seem that way. But this preference for low oxygen, that's actually a weakness we can exploit with this hyperbaric therapy.
Okay. I see where this might be going.
And it's called a histotoxic infection. Histo meaning tissue, toxic meaning poison. These Clostridium bacteria release powerful toxins.
That's the poisons.
Yes, poisons that directly kill our tissues. That's the necrosis part, tissue death. And these toxins spread, causing even more damage. Plus, the infection process itself produces gas, hence the name gas gangrene.
Wow. So it's the bacteria and the toxins and gas production. Sounds incredibly destructive. So how does flooding the body with oxygen in a special room help fight something that, well, hates oxygen?
Right. That's the core of hyperbaric oxygen therapy. The patient gets into a special chamber.
Like one of those big metal tank things.
Yeah, exactly. Could be a single-person chamber or one that holds several people. Inside, the pressure is increased, usually to 2 or 3 times normal air pressure.
Okay.
And while they're in there, under that pressure, they breathe 100% pure oxygen.
Pure oxygen, not just the 21% in normal air.
Correct. And the combination of pure oxygen and the high pressure makes a huge difference. See, normally oxygen is carried almost entirely by the hemoglobin in our red blood cells.
Right.
But under pressure, much, much more oxygen dissolves directly into the liquid part of the blood, the plasma.
So it's bypassing the usual carriers, in a way, just saturating the fluid itself.
Kind of. The red cells still get fully loaded, but the extra capacity comes from dissolving it straight into the plasma. The solubility of oxygen in plasma shoots way up under pressure.
Can you give us an idea of, how much more oxygen we're talking about?
Sure. So the amount dissolved in plasma increases significantly. For each atmosphere of oxygen pressure you add, you get roughly another 2.4 milliliters of oxygen dissolving in every 100 milliliters of plasma.
Okay.
So if you're breathing 100% oxygen at, say, 3 atmospheres absolute pressure, that's 3 times normal sea level pressure, the partial pressure of oxygen in your arterial blood, the PO2, can jump to around 2,000 millimeters of mercury.
2,000. Compared to what normally? Like 100?
Yeah, around 100 millimeters of mercury is typical breathing air at sea level, so it's a massive increase, 20 times higher, potentially.
Wow. Okay, that's like turning a tiny stream into a raging river of oxygen in the blood plasma. So this super-oxygenated blood gets pumped around the body and reaches the infected tissues. How does this oxygen surge actually fight the gangrene?
It works in several ways, actually. First, and maybe most obviously, these high oxygen levels are directly toxic to the anaerobic Clostridium bacteria.
So the thing they hate most? You give them loads of it under pressure.
Exactly. It has a direct bactericidal effect. It kills them. The environment they need to survive becomes poisonous to them.
Clever. Turning their own biology against them. What else?
Second, the high oxygen levels seem to interfere with the production of those dangerous toxins we mentioned, especially from Clostridium perfringens. Lab studies have shown this.
So you're hitting the bacteria and reducing the amount of poison they're pumping out.
Precisely. It helps limit the ongoing tissue damage.
That's a powerful combination right there. Does it help our body fight back too?
Yes. Definitely. It gives a significant boost to our own immune system. High oxygen levels increase the activity of certain white blood cells, leukocytes, and macrophages.
Those are the cells that, like, eat bacteria and clean up debris.
Exactly. The process is called phagocytosis. They're crucial for clearing infection. The extra oxygen in the tissues basically makes these immune cells work much better, more effectively. It's like turbocharging the cleanup crew right where the battle is happening.
Supercharging the immune system. Got it.
And there's another really important interaction with antibiotics.
Oh. How does oxygen affect antibiotics?
Well, for some important classes of antibiotics, things like aminoglycosides, cephalosporins, maybe quinolones, their ability to actually get inside the bacterial cell wall seems to depend on oxygen.
Really? They need oxygen to work properly.
The transport mechanism across the cell wall needs oxygen, yes. It's highly oxygen dependent, and it works poorly when oxygen levels are very low, say below 20 or 30 millimeters of mercury.
Which is exactly the situation you'd find in tissues affected by gas gangrene, right?
Yeah.
Low oxygen.
Precisely. The infection creates the very conditions that make some key antibiotics less effective.
So the HBO therapy helps fix that problem too.
It does. By raising the oxygen levels in those tissues, it helps those antibiotics penetrate the bacteria better and do their job. There have been studies showing the synergy.
Synergy, like they work better together than either one alone.
Yes. One study, for instance, combined cephalosporin antibiotics with HBO and found, I think it was something like 100-fold greater reduction in bacterial counts compared to using just the antibiotic or just the HBO.
100 times better. That's huge.
It really highlights how HBO can enhance other critical treatments.
Okay, so direct killing, stopping toxins, boosting immunity, helping antibiotics. Anything else?
Well, there's the straightforward benefit of just getting more oxygen to the tissues that are starved of it.
Reviving the local area, basically.
Absolutely. Gas gangrene causes tissue hypoxia, lack of oxygen. And we know hypoxia is bad for healing.
Yeah.
It slows down cells called fibroblasts, which make collagen.
Collagen, the stuff that sort of holds tissues together.
Right. Essential for wound repair. So by delivering more oxygen, HBO can help counteract that, supporting the natural healing processes.
Makes sense.
Plus, HBO can help reduce edema, which is swelling.
How does it do that?
It causes some constriction of blood vessels, which can reduce fluid leakage into the tissues. And when you reduce swelling, the distance oxygen has to diffuse from the tiny blood vessels, the capillaries, to the cells gets shorter. So it improves oxygen delivery that way too.
Less swelling, easier oxygen access. Got it.
And some evidence suggests it might even improve blood flow in the microcirculation, the smallest blood vessels within those compromised tissues.
So it's really attacking the problem from all sides.
Yeah.
The bugs, the toxins, the body's response, the drug delivery, and the tissue environment itself. Okay, so what does the treatment actually involve for a patient? What's it like?
Typically, a treatment session involves breathing that 100% oxygen we talked about.
In the chamber.
In the chamber, yes.
Yep.
At a pressure usually between 2.0 and 2.5 atmospheres absolute, or ATA. So 2 to 2.5 times normal atmospheric pressure.
And how long does the session last?
Usually around 90 minutes, maybe up to 120 minutes.
90 minutes to 2 hours breathing pure oxygen under pressure.
Correct. And it's usually not just one session. For gas gangrene, it often involves multiple treatments, maybe daily, sometimes for 10 days or even longer, depending on the patient's response.
10 days or more of daily sessions.
Wow. And you mentioned single and multi-person chambers.
Yes, monoplace chambers for one person and multiplace chambers that can treat several patients at once, often with medical staff inside too.
Okay. And how well does this actually work in practice? What does the evidence say?
Well, looking back at collections of cases, reviews suggest positive outcomes when HBO is added to the treatment for gas gangrene. There are reports spanning many years of clinical experience showing its benefits as part of the overall plan.
That's part of the plan.
Yes, that's really crucial. HBO is considered an adjunct therapy. It's used alongside and is not a replacement for the mainstays of treatment.
Primarily aggressive surgical debridement. That means removing all the dead and infected tissue and appropriate powerful antibiotics. Those are absolutely essential.
So surgery first to clean things out, antibiotics to kill the bugs systemically, and HBO comes in to help with all those things we discussed.
Exactly. It helps make the surgery potentially less extensive, enhances the antibiotics, and supports healing in the tissue that remains. Early studies also showed it helped reduce swelling and tissue death in muscle that wasn't getting enough oxygen.
So it's a powerful team player, not a solo act.
That's a good way to put it. It targets that core problem, the lack of oxygen that lets the infection run wild, and it bolsters the body's ability to recover.
Are there any, important things people should know? Practical points.
I think the main thing is that this isn't just something you can get anywhere. It absolutely needs to be done under proper medical supervision. You need specialized facilities, chambers that are properly maintained and operated, and medical staff trained in hyperbaric medicine to manage the treatment safely and effectively.
Definitely sounds like something requiring experts and specialized gear. Okay, let's maybe try and sum up the key points from this deep dive.
Sure. So, gas gangrene. Nasty infection caused by anaerobic Clostridium bacteria, thrives in low oxygen areas, produces toxins, kills tissue.
Check.
Hyperbaric oxygen therapy. Breathe pure oxygen in a pressurized chamber. This forces huge amounts of extra oxygen into the blood plasma.
Got it.
And this super-oxygenated blood then does multiple things. Directly harms or kills the anaerobic bacteria.
Okay.
Reduces their toxin production, boosts the body's own immune cells, helps certain antibiotics work better, and improves oxygen delivery to damaged tissues, reducing swelling and aiding healing.
So it really tackles the infection's root cause, the oxygen-deprived environment, while also supporting the other treatments like surgery and antibiotics.
Exactly. It's a multi-pronged attack focused on restoring oxygen to fight an oxygen-hating enemy.
It's pretty amazing, really, how manipulating something so basic like oxygen pressure can have such a profound effect on such a dangerous condition. Thinking about this, it really makes you wonder, given how critical oxygen levels are here, what other conditions, maybe where tissues are struggling for oxygen for different reasons, like poor circulation, or maybe really stubborn wounds that won't heal, or other complex infections? Could those potentially benefit from this kind of targeted oxygen boost too?
That's a really interesting question. It certainly points towards the broader potential applications of hyperbaric medicine, exploring where else manipulating tissue oxygen could make a difference. Definitely something to think about for anyone intrigued by this topic.